Hey guys, this is Dr. Mahajan from Mahajan Medical Center, continuing with our live broadcast, and I'm very excited today with a new platform. We're going to be talking exciting topics today. Let me get this working right. Yes, I think we're good. Can you hear me okay? If you hear me okay, give me a thumbs up and give me a love so we can get started. All right. Okay. So today we're going to be talking about what lessons we can learn from polio vaccine. And what does it tells us about COVID-19 vaccine, and then can we use those lessons for COVID-19 vaccine? The other thing we're going to talk about is how COVID-19, if it can enter our system through the eyes, and there's a lot of recent reports about that, so I want to discuss a little bit about it. The third topic we're going to talk about is the CDC updated their guidelines about antibody testing. So I'm going to be talking about that. Pharaoh Rock is watching us live. We appreciate you coming in, Pharaoh Rock. And the last topic we're going to talk about is information overload. And I know I'm adding that to that too. So we're going to see, what's your perspective. I want to get your comments on information overload. So give me a thumbs up if you're getting information overload. Let me know if that's what's you're seeing in your day-to-day life. Give me a yes, you're getting information overload. Put that in the comment section, and we can probably use it when we talk to other folks during our live broadcast today. So let's start with the polio vaccines lessons. As you know, the polio was, if you are an older adult, you may remember polio as being a big scare with a epidemic-like proportion in early 1950s. Our president there, FDR, suffered in the childhood as well. And it was a known enemy. COVID-19 is an unknown enemy, so that's probably is the big difference. But polio is a virus as well. And if you remember, and probably if you're not older enough, you may not remember, we didn't have institutes like National Institute of Health or CDC at the time in 1950, so there was no government or federal government kind of effort in developing vaccine for polio. It was all by private funding and private charity. There was an organization called National Foundation for Infantile Paralysis, which nowadays you probably know by the name of March for Dimes, which led the effort for polio vaccines development. So at that time, there were two candidate vaccines being proposed in early 1950s. One was by a famous virologist, Albert Sabin, S-A-B-I-N, and the other was also by Jonas Salk, S-A-L-K. And so the charity, pushed in terms of giving the funding to these two candidate vaccines. And I'm glad they did. It was one of the most successful vaccine in human history. If you look back, and now we don't think about polio at all in developed countries, except for small pockets in Pakistan and Afghanistan. The polio is pretty much eradicated, and thank God for that, because it took a toll on the kids. And, if you remember the heart and lung scare at that time. So what happened with the vaccines? Let's go back to that with polio. And so, Dr. Jonas Salk was a upcoming virologist at the time, and he had a brave idea that, if you take a live polio virus and put some formaldehyde and make it not virulent, then if you give it to everyone, then once they get the polio virus, then they won't. They have the immunity already built in. So they went with that, and the trials went well. So they put in the production phase with all the funding they got from March of Times organization. And long behold, they started seeing few of the kids who got the vaccine in early 1950s, I think around 1954, when the human trials or the kids trials happened. There were some kids who got the polio from the vaccine. So then the vaccination campaign was stopped, and they went back to the drawing board and started analyzing. And they found that there is a lab which was making one of the labs. So there were multiple labs to scale up the production. One of the lab was Cutter Lab, Cutter lab. And they found that lab was not, for whatever reason, the manufacturing errors or whatever, was not killing the virus enough, and that was causing to show, keep the virus live and strong enough, so that way, it got into the kids, unfortunately, and they got the polio from the vaccine. So they looked at that, and they eliminated that production line, and then they put it back in effect, and then everyone got the vaccine, which was manufactured properly, and they have good results from that. So the lesson learned there is, yes, we want the COVID-19 vaccine to come before, God forbid, we get the second wave of COVID-19 coming through in October, November, along with flu, and that will be deadly to have them both together. So, you got to be diligent. You will have a vaccine available, yes, but if it causes side effects like polio vaccine, and then it will be hard for the population to trust the scientific community for the second phase when we get a better vaccine. So we need to be slow, diligent, methodical, and test the vaccines. Let me know what you think about my thinking about the vaccine. You think we need to be slow and diligent? Let's see, we're getting some comments, and Mr. Gupta is here, and we want to welcome Mr. Gupta to joining our live broadcast today, and he, with his wife Nirmal, attends our broadcast regularly, so very kind of them. Now, let's talk about the second topic. Can we get the coronavirus through the eyes? So answer to that question is interesting, because as you know, Dr. Joseph Fair, one of the virologists, and he's a TV commentator, he got the coronavirus, he thinks, from the eyes when he was traveling in aeroplane from New York City to New Orleans. And he said he had gloves, he had mask, and he think he got it from the eyes with close contact with someone sitting next to him or close to him. Is that a possibility? Sure. The eyes have receptors as well. Rashmi joined us, and we want to say hello to Rashmi, and she is a good supporter of our Facebook Live endeavors, and we appreciate you joining, Rashmi. So coming back to, can we get the coronavirus through eyes? So the receptors in the eyes are very similar to the receptors in the nose and the mouth, but The big difference is eyelids, and I'll come to that in a minute. So theoretically, yes, you can get it to the eyes. And how you can get it to the eyes, let's say someone coughs and sneezes on a surface and you touched it and you touch your eyes, that's one way. Or someone coughs and sneezes directly on your eyes while you have a face mask. That can make you get it through the tear ducts, down into your nasal passages and down your upper airway. But, the chances of getting that is less. The CDC is also suggesting that if you're a healthcare worker or an anesthesiologist or respiratory therapist or an ICU nurse and you're suctioning these patients or intubating these patients, yes, you definitely need the eye protective goggles and shields to help you with the prevention of this possibility. But in day-to-day life, you don't need to, as long as you, what we know so far, that it will not cause, the chances of it going through your nose and your throat is much higher than through your eyes. There are some case reports of coronavirus or COVID-19 induced conjunctivitis. So yes, it's a possibility, but I think you need a bigger dose. And coming back to the eyelids, good Lord has given us eyelids. And so if some cough and spit coming our way, we kind of anticipate that and we close our eyelids. So that protects us. We have a inborn protective mechanism with our eyelids. So that's very helpful. So do I recommend wearing eyeglasses and safety goggles everyday use? Maybe not if you're practicing social distancing, but if you use the goggles or sun protection outside, so that should help you too. Maybe wash them when you come back home. So that's about what we need to know about whether it can go through the eyes or not. Next issue we're going to talk about is the CDC. We have Monica Mahajan listening to information from India, and I know Monica well because we're born in the same family. So thank you, Monica, for watching from Bangalore, and big hello to her. It's late in India, so that's very kind of her to watch from India. We got Ray and Carolyn watching our live podcast, and Ray and Carolyn are a strong supporter of our practice. Ray is a big shot UAW activist in our local community. He helps a lot of seniors with the benefits and the information they need from UAW. So keep doing the good work, Ray, and Carolyn is the brain behind the operations. All right, so we talked about polio vaccines. Again, people who don't know, this is Dr. Ranjan Mahajan. I'm a board-certified internal medicine physician here in Largo, Florida. And I will practice with my wife. She's the brains behind my operations, and 3 nurse practitioners. So we have 5 provider practice, and we've been very honored that we've been serving the community for 25 years. So it's a silver jubilee, in fact, for serving the community, and we're very honored that the community keeps supporting us. We still accepting new patients, so that helps us keep our lights on, and so keep referring your friends and families and neighbors if you can to support our practice and keep it healthy. So let's talk about the next topic, which is CDC guidelines on COVID-19 antibody tests. We're getting a lot of calls from patients about COVID-19 antibody testing, and I covered a little bit in my previous broadcast as well. And CDC gave an update on the guidelines for antibody testing, so I'm going to go through that in a minute. Let me know if you guys want to do COVID-19 testing. Put a comment in your broadcast, in my broadcast today, so I can analyze how much interest we have. I know we're getting a lot of calls So there's a lot of interest for that. So, but please do comment, give me love. If you like my broadcasts, do share with your friends and family. That keeps us going. It's a important time where you need good information. So we are very excited that we can provide that to you guys. And so let's talk about update on CDC on COVID-19. So if you had an antibody testing, please say yes, or you want an antibody testing, please say yes in your comments. And do give me a thumbs up if you like our new format. We put a lot of effort, me and Debbie, in putting this together, the new format, and we're very excited. We are not just on the Facebook Live today, we are on YouTube Live as well as Periscope Live. So this new format has given more opportunity for viewership. So we're very excited about that. So the CDC guidelines for antibody testing. Okay, so as you know, the Pinellas County, we're very fortunate. Our prevalence is not as much as, let's say, New York City or New Orleans. So if we do the antibody testing across the board in Pinellas County, chances are our prevalence is less than 5%. Now, if the chances of prevalence of antibody testing is less than 5%, CDC, based on the testing we have right now, 90% sensitivity and 95% specificity tests of the antibody test we have available, there is 50% chance that we can get false positive reading. So 49% positive predictive value. So that's bad. But that means, if you get let's say you come to my office and say, hey, Dr. Mahajan, I had a flu-like disease in January and, and the flu test was negative. Can you run an antibody test? Sure, I'll run it. And we have access to good testing. And that's the other thing we covered in our last broadcast. If you didn't see the antibody testing we covered, because it's very important not to do the finger prick testing. It's very important to do the plasma test through your venipuncture. And we have access to that through our office, through LabCorp and Quest and Baker. And those are strong tests from Abbott and Roche. But the problem is 5% prevalence of antibody or less in Pinellas County. So that makes the false predictive value 50%. So if you have a positive test and you get a false sense of immunity, and then you don't wear a mask or you don't do social distancing, and God forbid you had a false positive test, now we are giving you false confidence to not to use common sense measures. So that's the problem with the antibody testing in areas which are low prevalence. On the flip side, let's say if you do it in places like New York or New Orleans or hotspots, like a lot of places in Italy or Wuhan, where they have more than 52% prevalence of antibodies, the testing, the positive predictive value will be greater than 95% for the same test. So that's fantastic in those places. So, and the other important thing is, let's say you have a true positive antibody test, IgG. I'm talking only IgG. IgM, is transient. We're not talking about that. Right now, since it's a novel virus or new virus, the coronavirus COVID-19, we don't know if the immunity is protective. That's number one. Number two, and if it is protective, how long? So if you don't know if the immunity is protective and for how long, and in a low prevalence area like Pinellas County, if you have 1 in 2 chance of it being false positive antibody test, I think we got to be very careful in ordering these tests. We can do it, but if it come back positive, it should not be considered as an immunity passport. So that's the only question, I have for all you folks. Now, Delinda said she did the antibody testing. Yes. If you don't mind, Delinda, did it come back positive? If you don't mind sharing, but if you feel that's against your privacy, you don't want to share, that's okay too. But bottom line is, yes, the testing has a lot of curiosity value, but in terms of what can it give you in terms of what you can change in your behavior, or what can the business change? Let's say if we do testing in the hospital employees or nursing home employees, what can lead to any improvement there? I'm not sure about that. So that's the limitation of the antibody testing. Now, if you have questions about antibody testing, do put it in the comments section. We do check our comments even when you not watching it live. Once you come back from home and you see our live podcast on Facebook Live or on LinkedIn or on YouTube, we do respond to those comments. So do comment if you have questions, or you have experienced something different. So it's important for us to get your input in that. If you can hear me good and you like a new format, give me thumbs up, give me love, give me wows. I'll appreciate that. So Delinda had a comment. Let's put that up there. I would be interested in testing, haven't had it. So yeah, again, I have nothing against getting that tested, and I know we all curious beings. We just need to digest the positive or negative test with caution. That's the only thing I'm saying here, Delinda. So if you can hear me well, give me a thumbs up and give me your love, so we can continue with our work we're doing with giving good information to all our folks, all our community locally. Let's see. In terms of, so the other topic we want to talk about is the information overload. And I think I'm contributing a little bit to that too, so I apologize if that's the case. But I think if you think about it, the internet has led us to get so much information through different medias, social media, through TV, through news outlets, that it causing us to get overloaded with information. And what's the flip side of information overload? You would say, hey, we're getting informed, yes, but do we have control on the quality or the fact checking of the information coming through? The answer is no. It's a 24/7 cycle of news, and everyone wants the information quick and out. So the fact checking is not as solid in terms of the information coming through. So if that's the case, and we're getting too much information, what impact it has on our decision making? It can cause fogging of our cognitive ability to analyze the information and to work on it, or to sift through and use it for anything valuable in our day-to-day life. So in my opinion, I think we should unplug from Facebook, on YouTube, or whatever internet media or TV for a couple of hours every day to clear our clutter from our brain. So I'll give you an analogy which I found very useful here. So if you get junk food, it clouds your brain. You feel kind of lethargic and you want to sleep. Same thing happens, in my opinion, with the brain with information overload. So less is good, quality is important. So, and then, maybe take a walk if you're feeling confused with information, if yes, no, antibody testing, sure, maybe, then take a walk. The brain does analyze things better if it's not 24/7, it's like computer. If you're using the computer hard drive all the time, it's going to get hot and, it will slow down. Same thing with the brain, it will slow down. So maybe shut your eyes and do some deep breathing and take a walk. It will unclutter your brain and have you get the digestion or the analysis of the information coming through for you to make it actionable. So I think that's critical, that we do not get overloaded. And the other aspect of COVID-19 era with information overload is anxiety. Since we don't have vaccines, since we don't have good drugs yet, maybe remdesivir, maybe, as I said, and it's not widely available. And again, the data is limited on how good it is. We are getting anxious. We're getting anxious because we don't have control on this disease going away. It should have gone away yesterday in our mind and in our thought processes. And that's not going to happen. So, we just need to slow down and not overconsume the data. I think that's my thinking about that. If you have a different thought about information overload, share it in our comments so I can share with other folks who are listening. I think information is good as long as it's good quality, should be consumed in small amount, and we should unplug our brains from the constant deluge coming our way from different sources. And that leads to the segment we do every time in the end, which is breathing. So why, you would ask, that I incorporate breathing with the COVID-19 era? And I'll give you a few good reasons for it. If you don't know, we consume about 13 kilograms of air every day through our lungs. So 13 kilograms of air goes in and out of lungs every day. That's more than the food we consume, if you think about it. Another trivia for you is about 23 to 25,000 breaths we take every day. That's a lot of breaths we take. And the third trivia is, if you think about it, lungs or the breathing is one of the important tools we have to control our autonomic system. So for the people who don't know or who are not in medical field, the autonomic nervous system is composed of two systems, the sympathetic and parasympathetic system. And that's how the autonomic means it's automatic, maybe. So that means the heart does the beating on its own, the lungs do the breathing on their own, so we don't have to control it or forget to breathe or forget to take your heartbeat, then you die. So the body has come up with this fantastic autonomic nervous system. But on the flip side, we are not breathing as well. We are becoming more shallow breathers, and we're not breathing through our nose as much. We're not using our back muscles, our diaphragm, which is considered a second heart, as much as we gone through evolution in the last few hundred years. Let me give you an example. How many of you have heard of proning technique in COVID-19? Give me a yes that you heard about proning technique in COVID-19 patients who are on ventilator. Let me get a show of hands from the people who are listening if they have heard of proning technique. Okay, so people who don't know, the proning means that, typically before we had more knowledge about COVID-19, let's say in February or early March, most of the patients went on their back and standard ventilator when they went to respiratory failure, and they were not doing so well with the ventilator. So there's an old hack, it's called proning, where you put the patient on the vent on the side or on their back, on their tummy. And now you're certainly using the diaphragm more effectively. Now you're certainly using the back muscles more effectively. And back muscles are super strong and great way of expanding your lungs. So that's how the breathing is connected with the current era. And then the other important aspect is the mental health aspect. So, as you know, the anxiety coming through if you're not getting enough work, or if you're working from home with kids, with virtual school, and you got furloughed from your job, everything financially, and not having a control on when this is going to end, is adding to the mental health aspects of the COVID-19 pandemic. So the breathing technique, as I just alluded to earlier, you can control your autonomic system with that breathing better. So for example, when you do inhalation, When you do that, now you're activating your sympathetic system, which is the flight and the fear system that you have to run. And when you exhaling from your lungs, you're activating the parasympathetic system, which calms you down. So depending on which system you want to use more, let's say if you want to sleep better, then you want to have a longer exhalation in your breathing technique. And that will help you calm down and slow you down and calm your brain, and you can sleep. But you don't want to do the longer exhalation. Let's say, if you're working, then you'll be not able to, push if, let's say, you work in the emergency room or, a place where you need to have your sympathetic system working all the time. So you got to see which one or what scenario you're at. But it's amazing that you can control with just controlling your breath, that you can control your autonomic system. So that's why, I started incorporating the breathing with my COVID-19 pandemic talk. And I think a lot of you guys have responded well to that. So if you have done the breathing exercises with me in the past, give me yes, they've been beneficial, or no, you don't want me to continue doing it. Please give me an input. So right now, if you're listening, what you think about the breathing exercises? Should I continue doing? Let me get your comments here today, so that way I get the feeling whether we want to continue. And if, as I said, a lot of people listen to my talk after they come back from work in the evening, so you can still comment on our live videos afterwards as well, and we do respond to that. So today's breathing we're going to be talking about is the alternate nostril breathing. I did a little bit teaser yesterday with you guys, and hopefully you practiced it. And then we're going to do one today and see, you do it with me. So the alternate nostril breathing is one of my favorite breathing. It's also in yoga circle called Nadi Shodhana, or cleaning of your channels. So how do you do it is very simple. You need this mudra on your hand, the thumb and your ring finger and your thumb, little finger. And then what you do is you breathe out or exhale. Now you close your right nostril gently, and then breathe in through your left nostril, and then close that gently, and then breathe out through your right nostril, and then breathe in and close that, and then breathe out through your left nostril. Breathe in, close that nostril with your ring finger, and breathe out. Breathe in, breathe out through your left nostril. And that's one cycle. So if you can do it for 5 minutes twice a day, you will get the benefits from that. I also want you to practice that on a daily basis. It's like medicine we give for blood pressure or diabetes. If you take it once in a while, it will have effect on that day. It won't have a cumulative effect. Same thing with breathing techniques. If you practice it every day, whether it's the one I taught you today, the alternate nostril breathing, or you can go back to our previous Facebook Live videos, and we have other breathing techniques I've given to your toolkit, like the 4-7-8 breathing and the victory breath. So, and then I talked about square breathing too. So all those are good, and I explained to you why I think it's important for us to learn to control our breathing better, so that it will help us make better decisions and keep us calm, help us with anxiety, and help us sleep better. So those are the few of the benefits you can get if you practice that regularly. I'm going to be asking your input if you want me to incorporate other topics like diabetic education or hypertension or congestive heart failure, any other topic you think you want me to incorporate in my future broadcast, so we can diversify it more, so I don't add to your COVID-19 overload. With that, we want to say thank you to all our listeners who's been, listening to us so beautifully for all these months and has helped us to grow our viewership and share it with your friends and family. And as I always say, it's very important for us to be nice to us first, and then our friends and family, be kind to them, and the biosphere or earth around us. And with that, we want to conclude our today's broadcast, and we will put our timings for the future broadcasts. We may change the time, so look out for the event calendar, and I'm going to let you know. We will, now that people are going back to work, so we may not do it at 2:30. We will do it later time, so I'll keep you guys posted. So look out for on the Facebook Live. Thank you so much, and with that, keep the social distancing going. Ciao.